Supporting kids with ADHD takes patience, understanding, and the right tools. That's where we come in. This is ADHD Connect with Dr. Tish Taylor, your go-to podcast for expert advice, real solutions, and encouragement every step of the way.
Hi, Dr. Tish Taylor. Welcome to my ADHD Connect podcast. So for this episode, I wanted to have a commentary on a recently written article by Paul Tough in the New York Times Magazine. It's entitled, "Have We Been Thinking About ADHD All Wrong?" And a thoughtful piece, and I have some thoughts on it. So there's a lot in this article, and it's was in April 2025. So, and he brought up some questions about, we're seeing higher numbers of diagnoses in ADHD, and in turn, that means there's a higher number of medications being prescribed. And what exactly is ADHD? And, our current diagnostic criteria, he describes some of that on some level and talks about, are there other explanations? Uses lots of sources in his article, but there's some things that I wanted to hit on, and I want to stay in my lane, if you will, being a clinical psychologist and former school psychologist. So I'm not an academician and I'm not a researcher, so I'm not going to overstep my bounds in that way. So a lot of what I'm going to be speaking from is what I've understood the diagnostic criteria to be. And after doing, and I can safely say, thousands of evaluations and seeing families, children, teens, and sometimes adults, young adults, what I see in terms of the diagnostic criteria as it stands. And, another question that was raised is this neurological? Is there an environmental cause? I mean, how do we really think about this? So I will preface it by saying that it is deemed to be a neurodevelopmental disorder. So that is the current understanding in terms of the diagnostic criteria. So the Diagnostic and Statistical Manual deems it as a neurodevelopmental disorder that begins in childhood. So essentially what that means is there's some lag in growth and development when you think about those areas that are targeted when you're trying to say, does a person or a child have ADHD? And so essentially it means a lot of executive functions. Is it sustained attention? Are there delays and persistent difficulties with sustained attention, distractibility, organization? On the hyperactive impulsive side, increased levels of hyperactivity and impulsivity that, behavior regulation is more challenging, and this interferes with everyday functioning. Part of the diagnostic criteria is also, do we see this in more than one environment? And so that can get tricky because there's lots of variables at play, as you might imagine. So that is part of the diagnostic criteria. Another part is, have we seen it? Have we seen any of these patterns prior to age 12? A few of the pieces don't quite fit adulthood, right? So if you look at a couple of the descriptors, there's 9 descriptors for inattentive type, 9 descriptors for hyperactive impulsive type. So there's been a slight adjustment for adulthood. Now I have heard of, adult onset ADHD. In terms of the diagnostic criteria, that is not part of the diagnostic criteria. So I can't say I can speak a lot to that, but this idea of adult onset ADHD, I don't diagnose that because of the diagnostic criteria as it stands. Another question that the author brought up is, is there, and he was speaking to another researcher or, somebody conceptualizing this ADHD, is that, we haven't found a single biological marker. And I, in my humble opinion, the brain is just really too dynamic for that, especially when you're thinking about executive functions. There are so many neurons and neural pathways that are happening at any one time that I don't know how you would find a single biological marker. So it all appears, in my current understanding, is that, the brain is developing dynamically. There's certainly some developmental stages that are occurring. There can be insults to that in terms of that development, and there are certainly genetic components to that we don't have a full handle on. As I've seen so many people and kids over the years, you can't deny that there's a strong genetic component. When you see what looks to be a pretty clear picture of ADHD, you almost always see it in the family. And there's data and research about that as well. So, to say it's strictly environmental, I have a hard time grasping that one just because of the strong genetic component that is seen. So in case after case, I see that. It's hard to say it's strictly environmental because when you see children or individuals who struggle with these things really almost day in and day out in different environments, in different circumstances, a different teacher, a different school, you know, from, different developmental stages, it's hard to think it's just environmental, that there's something innate, or I'll just say something neurological inside of them that appears present. Now, where it gets tricky, I think, as a diagnostician and a clinician, is when it seems to be a milder case, and when some of the symptoms are more subtle, or when there's a borderline level of symptoms that seem to be reported, or they seem to be exacerbated in some circumstances and not others. Those are trickier.
Looking for expert-led courses, trainings, and tools to support your child with ADHD? The ADHD Store has you covered. Explore practical, research-backed solutions designed to help families and educators navigate challenges and build success at home, in school, and beyond. From behavior strategies to executive function support, you'll find the resources you need all in one place. Visit tishtaylor.com and check out the ADHD Store today.
So I really do think about ADHD on a continuum, right? So if you think about, we can all have difficulty with distractibility or doing something impulsive. But if you think about those individuals on the far end of the continuum who show those behaviors and symptoms, often frequent, to a more significant degree, and it's interfering with some of their functioning or much of their functioning, that's when we tend to make that diagnosis, as we've ruled out other things as well. So, but when those individuals look a little milder on that continuum or close to the threshold on the continuum, then that gets trickier. And so what you're trying to do is understand the entire history of the individual. Are there other things that might explain the behaviors? For example, is there anxiety, or is there something in the environment that's causing it? And boy, we haven't even talked about screens and technology, but that has certainly taken us by storm, if you ask me. And so what role has that played in terms of attention? But I will again say, as a clinician trying to diagnose or not diagnose, taking all those things into account. And so you're going through a list of rule outs, if you will, right? I mean, would there be something else that would explain what we're seeing, or does this appear to be innate and more neurological? So I feel like that's a big mouthful, but I always welcome, I think it's important, really so important, that we question what we're doing, or over time, if we're seeing trends or patterns, and that we're keeping ourselves in check, right? Is there another way we need to look at this? Is there another way we need to think about this? Of course, we need to do it with solid research and data as we do it. But, I thought, it was thought-provoking, and I wanted to follow up with it. But thinking about, is what is seen conditional? Is it transient? And in trying to uncover those patterns. So in the world of mental health and psychology, you're definitely trying to see patterns and what may be triggering those patterns, and how that may be occurring. The other thing I would say, in my prior podcast, I talked about co-occurring conditions with ADHD, and there are many, or in many cases, you do see co-occurring conditions. And so trying to understand all of that in context is really important as well. And I think the other thing this speaks to is really getting a good picture of what's happening and monitoring it over time. And so, do we see a change in what's happening? Do we see a change in the clinical presentation? Do we see a change with certain interventions? And some of those interventions may not be medication. Can we put solid structures, routines, reinforcement systems in place that may make a difference? Can we change up something in the environment that may make a difference? And seeing if some of those things work, if that's a good match for what the presentation is. Again, you can access my trait tool. I know I'd mentioned that in my first podcast. And that, again, is a good self-monitoring tool, a good tool to really identify, how things are presenting and what we're seeing. So that may be a good method to help determine, is this ADHD as we understand it? Does it appear to be something innate within the child? So I guess in summary, what I would say is getting a really good clinical evaluation may be really important. Some cases are a little more obvious than others. So, but either way, a good clinical evaluation is important to see what all those factors are. Are there any other rule out factors? Are there any environmental factors we need to be paying attention to? And I think continuing to monitor and evaluate over time are we still seeing a similar presentation? And as a child develops or as a person develops and goes through different stages, does this presentation appear to just follow them? Or, does something make it different? There was another intriguing thing brought up in the article, and that was, there was someone interviewed that said, once I got into a profession or something that I was really good at, I was motivated by, I really enjoy, some of these things dissipated, like they got better. And that makes sense. So what we see in, I'll say classic ADHD, it's not uncommon to see lowered motivation, even more so for things that are not preferable or not enjoyed. So we all have that, of course. But a lot of times you see it to a larger degree. It's a bigger ask to get an individual with that diagnosis sometimes to do something they don't prefer or to stick with it. So what I would say in that regard, again, is it coming back to this question, is it a mismatch between the environment or what's expected? What can be a challenge is how much of the environment can you alter? And I do think it speaks to a disorder if, I would have to alter so much of the environment or so much of the expectation that I've created an individual environment for this person because they don't function well otherwise. I think that speaks to some degree of a disorder. But I can acknowledge that, especially as a person is more mature and they can understand what their preferences are and what they love, and they can do that and pretty much survive in that and be motivated and complete tasks, that's great. My other question would be, are they still able to do those other organizational things that they don't love or prefer and manage their life in those areas too? So I think that would be a bigger question there. So a couple of my thoughts, on a thought-provoking article and some thought-provoking questions, which I think we need to continue. So I applaud Mr. Tuff for that. And hopefully that you've gained some insight with my comments as well.
That's a wrap on this episode of ADHD Connect. Want more strategies and support? Visit tishtaylor.com for expert resources. And don't forget to subscribe and share. Until next time.